Good.
Hi, everyone. Welcome to our latest episode of Community Connection. I know it's been a little while since we've recorded something. We're excited to be back. I'm Vicki Alorcia Casella, licensed mental health counselor in the Lehigh Valley, joined with my co-host, Mark Kenny. Mark, how are you?
I've been doing well since we've been apart, Vicky, but it's good to see you. It's good to
Yes.
get another show out there to our Lehigh Valley community.
Would you like to actually, Mark, introduce your position and role again, just to remind viewers, since it's been a while since we
Or
recorded?
that's true. I am the program director for the Masters in Clinical and Counseling Psychology program. It's Chestnut Hill College, but we're at the DeSales University campus. Um, and so that's being a professor, advisor, and been there it'll be 20 years this fall. So
20 years, my goodness.
been a while.
Yeah,
Yes.
that's exciting though. Okay. And then we will get into our guest in one moment. Before we get to that in our topic, we always like to share our disclaimer that if anyone who is listening or watching, if you're currently experiencing any severe mental health symptoms, to please reach out to your support system. There's so many wonderful supports in our community, your doctors, therapists, anyone in your support system, and of course us as well. We're always happy to help. So that leads into, I think that's everything, trying to refresh my memory of our normal intro. So then that leads us to our guest, Dr. Carol Corbett. Welcome.
Thank you. Thank you for inviting me.
Sure. And Carol, would you just like
Mhm.
to share your role?
Sure. So I'm a professor at Chestnut Hill College in the same department that Professor Kenny expressed where he works. I am the field placement coordinator. I teach primarily field placement courses, as well as some of the an eating disorder course I've taught, an assessment and treatment of children and adolescents, and a trauma course. So those are the things that I've taught for Chestnut Hill. I most recently, happily, became a program director for a new program that was just launched at Chestnut Hill, which will be a master's in school counseling. So I'll be program director for that. And in addition to that, I have a private practice, outpatient mental health, that's located in Emmaus.
That's a lot.
It is. It's a lot. I'm busy.
Congratulations. That's wonderful. Lots of hats. But that's so thank you. I mean, with as busy as you are doing so many amazing things, thank you for taking the time to be with us today to educate our community.
My pleasure.
So today we are going to be discussing, and correct me if I'm pronouncing it wrong, orthorexia.
Yes, orthorexia.
Okay. So let's start off with just defining what that is, because I don't know if anyone's ever heard that term. I know I haven't.
Yeah, interestingly, it's a growing concern, and it's not very well known or understood. Myself and a graduate student, about a year and a half ago, we presented at the Pennsylvania Counselors Association at Penn State on the topic of orthorexia, and we had so much interest. Therapists were coming past saying, I've been practicing 20 years and I've never heard this word before. And whenever I explained what it was, every person who we talked to said, I have clients who fit into this category. So it's officially termed orthorexia nervosa.
Okay.
It's not yet categorized in the DSM, although I believe in the next edition, it likely will be. It's becoming more and more prevalent. And basically what it is, it's a very simple disorder to understand, though it's very complex in nature, like other eating disorders. But basically it's an eating disorder that involves a very unhealthy obsession with healthy eating. So what happens is, people might start out just deciding that they're going to move to eating only organic foods. And then, they'll shift their eating habits to only buying stuff that Whole Foods sells or farmers markets. And then what happens as with a lot of other eating disorders, is that somewhere along the line, a line is crossed and people shift from just deciding that they want to change their eating to become more healthy to it becoming almost obsessive. And it becomes very disruptive then in their lives. And, you know, as we talk a little bit more, I'll explain some of what that looks like. But it ends up being very destructive, and it's very, very complicated. And I'll get to some of the reasons why, you know, as we move through the conversation.
Sure. Thank you for that explanation. And I know that we initially were planning on recording this episode, I think last month, because was it, correct me if I'm wrong, was it like Eating Disorder Awareness Month or something? Can you tell us a little bit about that? When was that?
Yeah, that's March of every year.
Okay.
Yeah.
Okay. So a little bit behind, but it's still very good awareness to have. So we will continue. Mark, go ahead.
Yeah, so Carol, go ahead. Maybe people in the community are more familiar with the other eating disorders that are in the DSM-5. So for example, how does it differ from anorexia or bulimia?
So obsession with weight is one of the primary signs of anorexia, bulimia, and some of the other eating disorders, but it's not a symptom of orthorexia at all. People who struggle with orthorexia, weight is never listed as a primary concern, but instead it's the object of the person with orthorexia's obsession with the health implications of their dietary choices. So people wind up getting incredibly caught up in what they eat, how what they eat is going to impact their body. And that it can morph into something that becomes more and more restrictive as they rule out foods that they don't deem to be pure or clean or healthy enough. So while a person with anorexia restricts food intake in order to lose weight, a person with orthorexia wants to feel pure, healthy, and natural. That's some of the language that you would hear people use who struggle with orthorexia. And the focus is really on the quality of food consumed rather than the quantity of food.
So where someone else would view certain foods as being healthy, they even go through the healthy food and kind of pick through of this isn't healthy enough, it's not pure enough, and then that's where this obsession kind of takes place.
Yeah,
I see.
Exactly.
Okay. What would you say are some of the main red flags? Like, how would we notice this? It's interesting that this is a topic because this year, one of my goals was to eat healthier and exercise. And so it's interesting that we're discussing this topic. What would be some red flags that we would notice in someone if this was a concern?
Yeah, so let me say first, you know, lots of people, just because of the movement in our culture, have moved trying to eat more healthfully. And generally speaking, there's not a problem with that. But just as with anorexia, people start oftentimes who end up becoming anorexic by deciding that they're going to go on a diet or try to lose 5 pounds. And then what happens is some line is crossed, they don't see that it's happening, and then they become more and more obsessed with the restrictiveness of what they eat and the weight loss. And it happens very similarly with people who suffer from orthorexia. So lots of people start out eating healthy, and so long as it doesn't cross that line, you could just stay forever in the category of just eating more healthfully, eating more organically, those sorts of things. But I actually put a list together of some things that I thought might be helpful just to kind of help people conceptualize what orthorexia looks like in terms of red flags and symptomology. So I'll just look over my list here. So if you ever wish you could just eat and not worry about food quality, that would definitely be a red flag. If you ever wish you could spend less time focused on food and more time enjoying life, big red flag. And as you'll be able to hear as I go through the list, the obsessive part of it and how it becomes like very interfering. If it seems beyond your ability to eat a meal prepared with love by somebody else, even one single meal, and not try to control what is served, that could potentially be a red flag. And any one of these things doesn't necessarily indicate orthorexia, but if you listen to what I'm saying on this list and say yes to 2, 3, or more, then you might have a problem. If things like love, joy, play, and creativity take a back seat to following the perfect diet, absolutely a red flag. And these are things that if you're ever counseling an individual, or if you're friends with an individual or a family member, and you're noticing that these things are happening, you might be witnessing orthorexia. If you feel guilt or self-loathing when you stray from your diet, even one food item could just really set somebody spiraling in terms of how they feel about themselves, because they've broken away from what their orthorexia self tells them they need to be eating. If you feel in control when you stick to the correct diet, so many people with orthorexia develop in their mindset what the correct way to eat is, and unfortunately it may start out to be nutritionally sound, but it winds up not being that way. So then, similar to other eating disorders, there becomes kind of this list of rules of what's acceptable to eat and what somebody with orthorexia would never permit themselves to eat. If you put yourself on a nutritional pedestal and wonder how others could possibly eat the foods that they eat, that would certainly be a red flag. Yeah, I think that's probably the primary list that I came up with. But can you hear in that how it's a little bit more obsessive than somebody who just, prefers to eat healthy, likes to eat organic foods, just kind of watches that? Putting yourself on a pedestal is really interesting, because it's a tough thing to notice in people, because oftentimes it's the thoughts that they're having in their head in judgment against what they're watching other people do. But where you really get to hear that kind of judgment is if you're working as a therapist with clients and they tell you that I can't sit at a family dinner, I can't go out to eat with friends without just critically judging everything that everybody's eating. Like if somebody orders French fries, I'm internally horrified, even though I sit there and act like, I'm perfectly enjoying myself. So those types of things I would suggest would be red flags to pay attention to.
I'm curious if we're going to go down the path where there will be some type of test. That's not the word I'm looking for, that we would give to someone, to determine, like, this would be the checklist that a therapist would go through, right?
Yes, we actually have one.
Oh, do you? Okay.
Yeah, it's an orthorexic assessment.
Okay.
Tool, and yep. And it is just that. It's a checklist that you hand to somebody and they check off. Do you ever, do you ever, do you ever, and it just goes through some of the things that I've said in addition to other things.
Yeah.
And then there's, a scoring grid that kind of alerts people to whether or not they've perhaps crossed over a line.
Good. Okay. That's interesting. Thank you for identifying those red flags.
So one of the things I'm hearing is the difference is that people who eat healthy do allow themselves to, and don't see food in a judgmental way, and then permit themselves to go off and have other foods. And it's that flexibility, adaptability, it's a conscious decision, and there's no guilt or remorse that, I went and had this non-organic meal with my extended family on Sunday because it meant being with my family. So that's, I'm hearing like that's part of one of the distinctions between a person who's trying to, primarily focus on a healthy eating behavior, but not necessarily becoming regimental or obsessive about it. They give themselves flexibility and don't really judge themselves when they do make poor choices that, that we all do, right? I mean, we never stay on something 100% all of the time.
Right. Yeah, that's exactly right. People with orthorexia won't allow themselves to deviate at all. And if they do, they're severely, harshly critical. And so for anybody
Mm.
listening, if you're thinking, oh, whenever I go out on weekends, if I have too many slices of pizza, I beat up on myself for the rest of the weekend and I might go for an extra run or an extra workout. That in and of itself isn't necessarily orthorexia. I mean, lots of people feel a little bit of guilt and remorse from overdoing it. This orthorexia is when people get into a pattern and it becomes their lifestyle and they will not deviate and they're fixated on what they're eating and what they're not allowing themselves to eat. And they become incredibly anxious if anything goes sideways and let's say plans change and they have to have a meal that wasn't planned for or that doesn't offer the foods that fit into their rule category. That's when it becomes like more of a mental health problem, is when the obsession kind of takes over and gets in the way of them being able to just live and enjoy their life.
Mhm. And Carol, I teach a development course, as you well know. And so, from a developmental perspective, there's certain developmental phases that eating can become become a potential issue for a person.
Yes.
Does this have any developmental theme, or this can happen across the lifespan at any time?
It can happen across the lifespan. It's usually not seen in pre-adolescence. It's seen in adolescence a bit. Oftentimes what happens is student athletes start with an incredibly healthy diet, lots of regimented exercise. And the deeper they get into the disorder, the more regimented and controlled their eating becomes. So it's seen primarily in adolescence, late adolescence, and young adulthood. But typically nobody under the age of 12, 13-ish, but there's plenty of adult women who whenever they, and men, but with most eating disorders, it primarily falls into the category of females. It's definitely a female heavy disorder.
Mhm.
But yeah, I would say that's primarily the population. Adolescents, young adults. I mean, it really is a rampant disorder and a little known one on college campuses.
Mhm. And you mentioned earlier, this is sort of unknown to counselors and other helping professionals. What does that mean for parents, or what does that mean for the everyday person if people in our profession are just becoming aware? So could you maybe talk about the challenges and talking about the challenges that therapists face that may also help us understand what the community member might be also facing if we ourselves are just getting a handle on this topic?
Sure. So if parents have a
Or loved ones.
concern
Mhm.
with, I'm sorry?
And loved ones, when you're mentioning partners or people who might be beyond their families. So
Yeah, right. Anybody, if
sorry.
you notice that somebody in your life is struggling with something that doesn't quite fit into the category of anorexia, doesn't fit into the category of bulimia or any of the other eating disorders that people do know a lot about, you might want to look up the term orthorexia and begin to educate yourself and just get a sense for whether or not you think this is what you're dealing with. But if you're fairly certain that this is what the problem is, you want to vet out any counselors who you call to set up appointments with if you're trying to get somebody into therapy, to find out whether or not the counseling staff is aware of what orthorexia is and if anybody has any kind of specialization in treating it. Because what I've found is even those who consider themselves to have a specialization in the area of eating disorders don't necessarily know or understand orthorexia. And what happens, and when you asked about challenges for therapists, sometimes therapists, if they don't know and they're not educated about this, can actually feed into the problem. So when their client comes in and talks very excitedly about the good work that they're doing in terms of regimenting their diet, eating everything they're supposed to, being really clean with their eating, a therapist can say, that's fantastic, good for you, you're doing a great job, I'm so proud of your ability to stay on top of things like that, without recognizing that it might have crossed over into an eating disorder. And by you encouraging the client, you might be doing more damage. So I think that would be the biggest thing that I would say to family members or loved ones, is that if you're in the position of getting help, or if you're in the position of having a conversation with somebody you care about struggling with orthorexia, you definitely want to alert them to finding a therapist that knows and understands what this disorder is, so that they don't make a mistake in being able to help. Does that make sense how that could happen?
Sure.
Yeah, because in our culture, I mean, it's celebrated when people are like
Mhm.
hugely into health and fitness and nutrition. And, you know, I hear it all the time in my own family. You know, people get very excited and supportive of
Right.
family members who, you know, might have gone to a dark place with how they're eating, you know, and what
Right.
they're doing with their nutritional habits.
Right. Right. And for our professionals out here that might be listening to the program, are there any what is in the literature? What is available for professionals who want to learn more about this?
So what has been researched, and I believe my personal thoughts are why it's not yet in the DSM is because it's an emerging eating disorder. So there's not a whole lot of research behind it. So there's not a whole lot of evidence of what works and, you know, things that have to exist for a period of time before the DSM picks it up. I have a feeling though, like I said, in the next iteration of the DSM, this one might be given a look. But what we do know just through the research that does exist, and a lot of it is overseas in New Zealand and Australia, believe it or not, but cognitive behavioral therapy seems to be one of the best forms of treatment. I believe that part of the reason for that, just in my own personal experience, is I personally consider eating disorders to be eating disorders, but also thought disorders, because there's so much going on up inside of a client's head in terms of how they're thinking about what it is they're doing, putting in their bodies, not putting in their bodies. And I believe orthorexia kind of fits into that category. So cognitive behavioral therapy, if you're a therapist, allows you to get in there and really work with the client on adjusting and assessing their thoughts and how their thoughts are factoring into the choices that they're making around their nutritional habits.
Mhm.
So specifically, some of the things that could be used in counseling sessions that would be helpful is to help a client develop something like a food hierarchy where they can examine how they can, a counselor could examine with a client how they feel about certain foods and their willingness to eat those foods. And then the hierarchy would list the order of fear level associated with certain foods. And then with therapeutic support, you could work on kind of like exposure therapy, where you would start from the least fearful foods for somebody struggling with this disorder and work to have them try to adapt the least fearful foods into their diet and work their way up to be able to eat just the full range of anything that's available.
Mm-hmm. That's interesting. That makes perfect sense. Just how you're explaining it all, the thought process connection, the hierarchy. It makes sense that that would be the form of treatment to use with these individuals.
Yes, and because a lot of times anxiety really spikes for individuals around what they're able to eat and not able to eat. Sometimes, depending on the severity of the situation, anti-anxiety medication can be incredibly useful combined with, you know, the talk therapy. You know, if anxiety is an underlying cause, but it's absolutely necessary to work with the client to change their beliefs around what it is that they're doing and, you know, how they're choosing to eat.
Any other treatments that you would add to that list?
It's a
But
tough
that's probably
one.
the main one, like with the education and what you're learning about right now, that seems to be like the main area of focus.
It definitely seems to be the main area of focus. If you were to call places like Renfrew or Princeton's eating disorder clinic, they don't specifically say that they treat orthorexia as an eating disorder. And, you know, I had an individual not too long ago that attempted to get admitted to an eating disorder clinic and identified as having orthorexia, and they wouldn't admit her.
Okay.
Yeah, because there's very specific criteria that has to be met, you know, if
Sure.
you're entering an eating disorder clinic with
Sure.
anorexia or bulimia,
Yeah.
and orthorexia is not either of those things. So then it just becomes really difficult to treat outside of, you know, maybe an intensive outpatient program for eating disorders. there could be a good fit there, or individual outpatient mental health therapy.
So, I mean, in a sense, it was probably good that they didn't accept her because they weren't trying to work outside of their realm of knowledge, and they could have been more harmful to her treatment. But was she able to then find another site that could offer her treatment more intensive?
Nope, she was able to continue to work with me through outpatient therapy. And you know, I don't know what people know about the treatment of eating disorders, but it very much parallels with the treatment of addictions in that it's extremely slow going, and there's a really, really high rate of relapse. You know, so people can be in and out of treatment for years and decades, you know, before they're able to fully get a handle on their eating disorder. Because as you know, I mean, I say this in the eating disorder class that I teach, unlike addictions like cocaine or heroin or alcohol, people can live without those things in their lives. There can be abstinence as part of the recovery process. But when you're dealing with eating disorders, people still have to eat to survive. So it adds like a layer of complication in terms of treatment.
Nicely worded.
Yeah.
I'm wondering, you know, because in some treatment modalities in eating disorders, focus on family systems. So I'm just wondering what experience or what have you seen in the connection in terms of family systems approach, or even conceptualize family systems?
Yeah, there in the literature that I've investigated, there doesn't seem to be a parallel with implementing family treatment as strongly as there is with anorexia. You know, where with anorexic individuals, oftentimes, especially kids or adolescents, parents are tasked with plating the food. You know, there's this whole treatment philosophy that the parents just take absolute control over what their child eats. And the child's not allowed to eat if the plate isn't plated for them, is the terminology. So the parent determines and is educated on how many calories, how many fat macros, how much protein goes on a plate. And then they sit with the child and work to support and encourage them to finish everything on that plate. That really is not a treatment that I've come across for orthorexia. But I mean, you know, if you're talking about a young adolescent or, you know, anybody in the high school age range who's still living at home, I could absolutely see the value of educating the family and maybe doing collateral sessions or family sessions, you know, just to see if any of the underlying causes for this need to kind of get themselves into this very nutritionally restrictive habit could, if family dysfunction or problems could underlie that. And then, you know, my gut as a therapist is just telling me then you would want to work out some of that stuff, you know, in an effort to alleviate some of the anxiety that's maybe driving the orthorexic behavior.
Right. What are the other factors to take into account? Yes. I'm just curious about that. That you're finding the research and work being done in Australia and New Zealand, and what's your take on the fact that the down under helping profession seems to be focused on this, and where it seemed to be coming from? Any thoughts or
honestly, I am not sure how to make sense of that. I wonder if it's just something that researchers took an interest in that particular set of universities that really hasn't kind of migrated to the United States yet. Yeah.
So
there's actually a lot of tremendous work done with eating disorders in general in New Zealand and Australia. I mean, a lot of the literature that drives how we treat anorexia and bulimia comes from other countries, including the UK. Yeah.
Thank you.
So as far as what resources or organizations or just where either therapists or the community could start, like the starting point to educating themselves and researching this, any suggestions that you have?
Yes, the National Eating Disorder Association, I believe, has information on their website. There's, I had a, if somebody wanted to Google search Jessica Setnick, Setnick. She's somebody who's done a tremendous amount of work, and she has a lot of really user-friendly diagrams and visuals that explain orthorexia that might be useful. Yeah,
Fantastic.
for access. Yes, and also I'd be happy, I shared earlier before we started recording that I have a tremendous amount of resources that I didn't pull together for this interview, but if people are interested and would like to contact me, they can do so through my Chestnut Hill email account, and I'd be happy to share any information that I have.
Sure. And what is your contact information so viewers can write it down?
Sure. It's Corbett, C-O-R-B as in boy, E-T-T-C @chc.edu.
Wonderful. Any other ways that someone can contact you, or your preference would be through email?
My preference is through email, just because I'm so busy through the day. It's hard for me, but I can
Sure.
always like access my computer and
Sure.
you know, fire off an email in a quick 15 minutes, but I might not be able to return phone calls, or
Absolutely.
the whole phone tag thing
No,
happens.
I understand that. This has been amazing. So much good information that I'm sure a lot of our viewers are not aware of. Mark, any other questions or thoughts that you wanted to bring up, or Carol, anything that's coming to mind that we maybe forgot to ask you about, or any last thoughts?
I don't think so. I think we covered everything that I was thinking about wanting to talk about.
Okay. All right. Well, thank you so much again for being with us today.
Yes.
This was fantastic. To our viewers, if you have any follow-up questions, please reach out to her. And future episodes, if there are topics that you feel like would be beneficial for us to cover, that you think our community is struggling with or would benefit from information, please reach out to Mark or myself. We're always happy to offer more awareness and support any chance that we get. Thank you so much. Stay tuned for our next episode.
My pleasure. Thank you. Take care.
Bye.
Thank you. Bye-bye, Vicki.
Bye.